This is Tiffany Robinson, Training Specialist for ComForCare Franchise Systems, and welcome to the ComForConnections Podcast. In this Masterclass episode, Masterclass Aging Services Pro, Strategies Addressing Relocation Stress Syndrome, I am joined by Colleen Toebe, Director of Consulting Services for Pathway Health. Listen to this Masterclass episode as we delve into the latest strategies and best practices for addressing relocation stress syndrome, and strategies to better support individuals experiencing it will ensure a better quality of life and a successful care transition.
First of all, as healthcare providers, we need to understand what relocation stress syndrome is. Within this, relocation stress syndrome is a topic that can affect all individuals. We often think, well, what is relocation stress and why is it important to our industry? It's extremely important. It not only affects individuals like myself moving from one location to another or moving from one job to another, but it specifically impacts those older adults with greater severity. The older adult is not only dealing with the physical changes, the psychosocial changes, even the loss of a spouse. But in addition, we've got to understand this syndrome to ensure the transitions have positive outcomes. Relocation stress was first defined as a syndrome in which the physiological or psychological disturbances were a result of that transfer from one environment to another. This is something that hasn't been around since the 1960s, but was first identified in 1995. Relocation stress may also be known as transfer anxiety or transfer trauma. So what truly is relocation stress syndrome? Well, relocation is a major transition that can affect even healthy individuals, either positively or negatively, moving from one place to another. Many older adults will relocate at some time during their lifetime. That's quite normal. Relocation is a very complex process that requires careful reconsideration and planning before the move. I'll discuss individual characteristics and types of plans, such as your pre-location plan and your post-relocation plan. Within this transition is very complicated. Within the older adult, oftentimes multiple chronic diseases, cognitive impairment, dementia, mobility, and sensory deficits like vision and hearing. When I look to see what relocation stress syndrome is, you've got that individual that is at an emergent level related to things we have absolutely no control over, such as weather, flooding, forest fires. And let's take a little time and think back of what's happened in our nation this year. As we look at relocation stress, that very important topic, I'll talk a little bit about what happened in Colorado when there was such severe weather and severe wind that they had to evacuate assisted living facilities due to the fact of lack of power. How long could your assisted living or nursing home or your individual living in a home that needs oxygen go without power? In addition to this, remember the forest fires that hit California. Those types of facilities, especially those in senior living, were evacuated, and most of them resulted in being relocated to the Bay Area of California. I just happened to be out there at that time, and I identified that those individuals coming into, whether it was nursing homes or assisted living, had to have those needs met. And oftentimes those seniors required assistance to eat and bathe and take medication. And then we had the challenges with those with some form of dementia, and especially Alzheimer's disease. They put a plan in place, and they identified those with dementia, and the Alzheimer's Association assisted with volunteering to make sure this transition to these evacuation centers were less distressful, because an individual that has got Alzheimer's moving into a relocation due to a significant event may actually wander off. And then last, the flooding. You've seen the flooding on TV over and over again. And with this, Florida, the evacuees had to be transferred from nursing homes and assisted livings into nearby hospitals and shelters. And of course, we had to take steps to ensure that the trauma related to those moving, especially the elderly, during these environmental changes posed the least risk possible. As care providers, we are required to have emergency preparedness plans, and especially things that will look at that relocation. So from today's topic, moving on to things that we cannot control, such as our environmental problems that will occur with weather, we have to take a look at what about basic moving? Well, though it might not seem like a big deal, it is a big deal for our older adults, especially when they may not desire to move. We have children that come and say, you're not able to stay at your own home anymore. We need to move you where you can be more supervised. With this relocation stress syndrome, also identified as transfer trauma, those symptoms can influence our behavior. If you look at this on an individual basis and you remember those people that have come in from home to the nursing home, their home to the assisted living, or even into an independent living environment that they now are receiving services, anyone can experience this. Individuals with depression, anxiety, individuals that have some forms of dementia, and then those chronic diseases. But the one thing with relocation stress that we need to take very close look at is how is it going to impact that older adult? They've had studies and many, many studies on this. And as individuals move from their living environment where they were independent, a lot of these disorders have gone undetected. And these adjustment disorders have been oversimplified. Oh, they'll get used to it. It won't take mom very long to get used to moving into this assisted living. They have a lot of things going on there. But that loss affects those older adults. And we can't simplify this. This trauma, this relocation stress syndrome and trauma that happens is expressed in different ways by different individuals. A lot of times they're extremely lonely. They miss going to their neighborhood grocery store or seeing their neighbors out on the lawn. They miss things that they're used to, and then getting used to individuals that are living within that community. Oftentimes, again, they're linked to loneliness, depression, anxiety, and, of course, changes in their overall health problems. Research, again, has stated that those adults within studies have varied, and any time we have that relocation, whether it be an urgent situation or non-urgent situation, many may die within the first year, about 40% in a recent study. People that were more vulnerable to this are those that had low physical functioning and over the age of 85. Changes happen as our body ages. I mentioned the sensory deficits, the ability to hear and see, and moving into that new environment. They impact their loss and their self-control, their self-identity, and their self-worth, and then the lack of privacy. I was living at home before, and now someone's knocking on my door wanting to give me medications. Why can't I give my own medication? The psychosocial transition is highly stressful. That lack of dignity and self-worth, and that ability to now share spaces with individuals that you may not know. I'm going to also discuss some of the concepts of moving from one permanent residence to another. And sometimes it's precipitated by a hospitalization. I've fallen at home. I didn't fracture anything, but the family thinks that I need to move. Within that relocation stress syndrome, we have got to understand that the chronic health problems and that stay in the hospital is going to exacerbate our pre-location time period. Our time period related to pre-location stress is not going to go away in 1 month or 2 months. It might be there up to a year. With transfer trauma and relocation stress, which can be considered to be interchangeable, are known by the American Association of Diagnoses as relocation process. Within that, these things can have some problems with confusion and hopelessness and restlessness, in addition to fatigue, inability to focus, inability to apply changes such as eating and sleeping habits, inability and susceptibility to diseases. This inability to care for self is going to impact that older adult. Factors related to transfer trauma. And these risk factors are based on that individual. As healthcare providers, we need to be able to assess this and assess those specific things that will relate to those individuals coming to live within our organization or your assisted living, home care, or hospice. So what are some risk factors? Well, risk factors in its entirety, and this is just kind of a short list, but risk factors include those individuals that have some limitations getting around. We know in the nursing home industry and the assisted living industry, something has happened to precipitate that. Maybe they can't take their medications, or they've had some increased dementia and cognitive impairment. They're struggling at home. They're lonely. They can't manage that home maintenance, or they feel unsafe. And if you turn on the TV right now and you look at the news, even one evening, there's violence in the news, whether it be in our local community or even nationally. Women are extremely vulnerable. Not only are women still living longer, but they may be without their spouse, or they could be widow or widowers. Residents, relocation stress, anytime an organization is at risk of closing down. And we've seen some organizations, long-term care facilities, assisted living facilities that have either at risk of closing down or have had to close down. I gave a lot of discussed natural disasters that require individuals to relocate, and that relocation process is probably going to be in the middle of the night or at some period of time when we got very, very short notice. So those natural disasters have got to have some focus as we look at relocation stress syndrome. Then other risks will include things like cognitive impairment. Now, if you've got sensory impairment, people are not able to hear or not able to see, it could be identified as cognitive impairment, and it might just be sensory deprivation. With this, long-term care facilities, living in a long-term care facility, assisted living facilities are risk factors. Little or no failure with support systems. And then, of course, a diagnosis that includes dementia. Nearly half of the individuals that live in facilities such as long-term care and assisted living have some form of cognitive impairment. Within this, overall, we're seeing a rise in those that are experiencing Alzheimer's disease and essentially any type of cognitive impairment. If they've got a diagnosis of cognitive impairment, it is going to go ahead and impact how they're able to transition and the health effects that could be attributed to transfer trauma. The relocation and the research demonstrates that those with the population and the aging population have concerns related to things as pre-location and relocation attributed, such as premature death. A lot might be dissatisfied with the move. There could be a withdrawal of social activities, a decline in physical, mental, behavioral, and the functional status and functional well-being. A high level of stress is very problematic, and we oftentimes overlook signs and symptoms of stress. We talk a lot about how caregivers need to take care of themselves. How about those individuals? What are some signs and symptoms of stress? And those individual patients, is it causing disorientation? You know yourself, if you're driving down a road and you're not really sure where you're going, do you feel a little stressed, especially when that Garmin or that special little voice that's coming through your car speaker is now failed? That's stressful. That disorientation and that fear of not knowing who you're living with, fear of going out to eat in an area that you're not and very unfamiliar with, and then the reaction. And you know yourself, and as we screen people for home care services, as we admit to assisted livings or nursing homes, do they have a lot of questions? Repetitive questions. We're constantly asking them about certain things. How are they feeling? We're testing cognition. We're asking them questions about culture and race and how they were doing at home. Those repetitive questions can cause stress. And then other symptoms and health effects that you're able to identify could be that pain, sleeplessness, and poor appetite. How often do we track sleep behavior when an individual has come into the facility? Or do we wait for it to become a problem? Are we asking about an individual and their pain level or their confusion? And then tracking their appetite. They could say they don't like the food or they just don't feel like eating. But think about those individuals that have come to live with you in the past month or the past week. And then what are some questions that we could ask as far as pre-location? Well, could you describe the information you would like to prepare for the move? Oftentimes with an assisted living facility and home care services, we go out to that individual and ask them about what information they would like. I've had individuals state to me, well, this isn't my decision. The family says that they're going to do it. Or I didn't make this. My niece said I needed to move out of my house. But is the family assisting? And how is the family assisting? Were you provided with a list of items that you could bring to your new location? Look around your homes. And if you were giving 2 containers, kind of like moving into the tiny house, what would you bring with you? Are you providing a list of items that you could bring with? And then, is the staff available for questions on the upcoming move? How are we going to provide that feedback before they come to live with us? Now, as we discuss the 3 locations and the 3 phases of relocation, it's important to understand each phase and how it affects this. The pre-institutional phase does affect us, and how relinquishing our personal effects, causing feelings of grief and loss. All of a sudden, I'll say, we need to have a power of attorney. I need to be able to manage your money. And here you were an accountant. Why is somebody taking that away from me? At this point, well, nursing staff are not usually involved with the residents and their families during this chaotic time. It is absolutely important that we develop a plan for pre-institutionalized phase. Anyone that's coming in, who's discussing this with the family? Are the children just saying, you're going to move today, we have to get you out of your home, it's too unsafe? The second phase is really that transition phase. Now I'm here, what am I feeling? Well, families usually visit quite often initially, but the individual client may feel like during that transition phase, they feel abandoned and a lot of vulnerability. They may respond with anger or a sense of injustice. Would you be angry if someone moved you from your home or your apartment and didn't give you a lot of time to decide? With these negative responses, commonly to those who are involuntarily placed and even voluntarily, they can last way over a month. And as a healthcare provider, I could not really understand, well, they've been here a month, they should be used to this by now. But that is not true. Research says it could be those feelings and lack of that placement can last during that transition phase 3 to 6 months. Another important thing that staff need to know is that Are we acknowledging that individual and their former roles with the respect and dignity? How about their impact to society? And they have a loss of that social status and that role. They're not able to do what they were currently doing. The post-institutional phase is that adjustment, and I mentioned 3 to 6 months for transition. It can take up to a year to adjust to a new facility or a new living arrangement. Although residents and family members and care individuals or care providers, we expect this to diminish once they get used to it, but it doesn't diminish. The psychosocial issues related to establishing that sense of control and identity, this environment, needs to be identified. And if they do have anger and difficulties, look at how we can adjust that. And I'm going to suggest that medication is not the answer. We need to provide that support and understand what they're feeling. Pre-location, how can we address that? Well, if someone is coming in to live at our assisted living, they might need communication early, with a small emphasis in the importance of communicating with the older adult early and clearly. Keep things honest. Tailor to the level of understanding and explain what's happening. Encourage that sense of participation, making the transition less daunting and encouraging that older adult to participate in that decision-making capacity. Change in life is much more difficult if they feel it's forced. Correct? All of us have family members that have probably had to live in another area as they've aged. This ability to participate is important. Maybe they need to tour the facility, not just the family. Bring your loved one to take a look at that assisted living or the nursing home. And then how do we create that sense of home? By allowing that loved one to personalize their space. It would be wonderful in every facility, whether it be assisted living or long-term care, post-acute care, that everyone could have their own room. So they could decorate that from items from home. Establishing routines and encouraging social interactions ease that sense of ease that transition, and take the time. A lot of things are rushed, and this is something that cannot be rushed. We also have to grant autonomy. People are each individual. Try to facilitate activities and routines that are tailored to their interests. Not everybody likes bingo. I know it's hard to believe, but not everybody is going to like bingo. And then address the concerns by openly discussing these concerns. We suggest asking about specific worries, like, what are your concerns with living here? Are they able to take, once this transition occurs, and then be very proactive and address these apprehensions in a smooth adjustment and process? I know we've all heard the term ageism. Well, we want to avoid ageism and avoid assumptions. I mentioned bingo. My father's older. He is not going to play bingo. So just because most people like it, we've got to remember that each individual is unique. Take the time to identify this and then honestly connect with that specific personality. Share meaning within their life. And if we have to, seek professional assistance. If the signs and symptoms of transfer trauma persist or worsen, ask medical and mental health professionals at your facility. Seek support. Relocation generally involves adjustment. It's like getting a new job, moving to a new community. It doesn't happen overnight. Work with those groups. We've got our transition phase. And as we transition, our second phase, this phase is key. And the key point here is allowing the adult to make decisions. Taking the time. I mentioned you must get to know that individual adult. We must understand what their needs are, and they must feel part of our community. Their new home, they must find meaning. And what are the environmental characteristics? Is it something that they're used to? Maybe they don't want to exercise, and they'll say, well, we have to go to exercise group. Or this new home is very different than their previous home. In addition, they might be moving cross country, going to some new state and new community. This role of adjustment is important, and transition is the key to success. I identified that when we do assessments, and I'm using the OASIS E as one form of assessment in which we know overall within the organization, a lot of us might use the MDS or some other assessment, but you can see here that it's looking at those individuals and how this living situation was. Check with your home care provider when they've done an assessment or they're going to be providing services. What was that patient's previous living environment? Did they live at home with other people? What was their availability of assistance? Did they live in a congregate situation? How are we going to go ahead and adjust for that self-care and mobility? Is that individual had a history of hospitalization or the risk of hospitalization? All of these elements are important as we develop that plan of care, that culturally competent plan of care. This is terminology many of us have heard, but culture. We all have culture. It doesn't mean you have just immigrated to the United States in the past 2 years. We all have a sense of culture. It's that sense of being able to apply our systems and structures, our beliefs and norms, and our values. What influences about natures of relationships, and how do we see the world? As healthcare providers, we need to be culturally competent and understand those individuals that are coming to live with us, understanding transfer trauma, understanding that these culturally competent abilities will address that diversity, conduct assessments. As care providers, we have to avoid stereotypes. Individual needs are the focus. Managing those dynamics and conducting self-assessments. With this, adapting to diversity and the cultural context of our community. What about those individuals that have some trauma transitions related to moves, and those individuals that may also have PTSD or post-traumatic stress syndrome? How are they affected during this relocation and relocation stress syndrome? Something to think about. And as we develop that care planning process and look at our person-centered care, we've got to deeply understand that resident and that individual client living in our organization, whether it be hospice or home care or assisted living, independent living with services, and skilled nursing homes. Each of them require a plan of care. The care planning must be complete and adequate. If not, it may end up negatively affecting those individuals that we're providing and that are moving into our organization or our facility. We are required to develop a plan of care, and it must be person-centered, taking into all aspects. And how many of your care plans right now have a goal as far as relocation stress syndrome as a problem? I would guess not very many, because in my experience, I haven't seen any or barely any related to relocation stress unless an organization is closing. The facilities need to look at the physical, mental, and psychosocial needs and preferences of the client that we're caring for. The person-centered care just means simply focus on the individual, understand the individual, have the ability to communicate with the individual, understand their daily routines. If they went for a walk every morning when they were living at home, can you provide that walk every morning when they've moved into your building? What are some things that they're demonstrating that could be nonverbals that might identify the depression, the anxiety, or that feeling of loneliness? We must take each individual client and look at what they prefer, not what we offer, what they prefer and what was important to their lives before coming into a nursing home or assisted living. Be sensitive to their desire to involve in decision-making. Always discuss things. And I know as a healthcare provider and as a nurse, I always thought I knew best. It took me a long time to figure out I knew nothing. Well, respect their needs and values related not only to their personal values, but their ethnicity and interests. Our interests are not all the same. Just because you're older doesn't mean that every older person has the same interests. The interventions and the support is needed many months after relocation. Does your social worker come in and visit with individuals for up to a year to discuss relocation? Then some very good practices and some key things that we need to focus on as we've identified those individual needs. Engagement. Look at how we're going to engage individual in this decision-making process. Identify their needs based on your assessments. The person-centered plan of care is going to follow through with all of the things that we do in our organization. Why did that individual come to live with us? Was it related to a fall at home? Was it related to some accident or medical incident? They forgot to take their medication. They may not be able to identify the types of pills related to a visual deficit. And then we must involve that staff. Staff need to be involved in identifying and assessing and experience strategies with relocation stress syndrome. The older adult could have difficulty making some of these decisions, but you've got to do your best to make sure that you keep the individual involved and listen to their response. Take some time. Well, make sure they can hear what the questions you're asking is also important. That downsizing will likely be an emotional process. And I'm going to give you an example of an individual a couple of weeks ago I met with, and I could not figure out why was she not feeling very good, or she wouldn't look at me. And come to find out with this, the children had taken it upon themselves to clean her house out and sell or give away her items, and did not take her out to the home or provide any input in how things were going. Well, she had just moved into an assisted living and definitely feeling relocation stress syndrome. But by downsizing and that emotional response, Emily could have done something a little bit differently. Take her to the home. Let her go through her things. What are these things that meant so much to her, and where did they go? I know people have been upset because they can't find their sewing machine. Little things like that are going to help that transition into your organization. And then make sure we try to set up spaces that are familiar to them and maybe within similar to their old space. If they've got pictures, where were the pictures hanging? If they had a bookshelf, what was on the bookshelf? Most older adults, myself included, we want to prefer staying at home, but sometimes moving is necessary. With this, the transition needs to be smooth and seamless. So what are some takeaways and important resources on this? Well, keep the client involved. Build on their strengths, not their weaknesses for that older adult. It's easy to see individual weaknesses, whether it's your spouse or your children. It's easy to point out weaknesses, but you need to build on that older adult's strength, because experience and some of that loss is going to occur during relocation. Provide those opportunities to discuss these perceived losses and grieve. Are you going and talking to them about how they feel after the move? I don't think I have. It's important. Involve the family. Involve the family and say, talk about this to your mom and dad or your aunt and uncle. Make sure we're prepared for these emotions. Guess what? Emotions are part of this transition. And then for individuals that might have this transition or they might have some dementia, I'm going to give you some key points here. For those that have dementia, moving is extremely scary. So if your older adult doesn't express fear or anger at the move, validate their feelings. Never argue or disagree. When we move an older adult with dementia, I suggest moving during the midday or mid-afternoon. Early morning, when you're moving in, people are busy in the assisted living or nursing home. They're hectic time. You need a time when it's calm, and the calm entrance will be less alarming to those that live with dementia. Then planning a move, always look and set the stage. Arrange the room with familiar items before they arrive. Allow for quiet adjustment, a time for your elder in their new room before venturing out into areas or other areas. And keep in mind that these places can be very intimidating, and it's exacerbated with those with dementia. If you have an individual with dementia, it's a good idea as you move them in or the family moves them in not to tour the whole community at one time. Just try to do it and maybe do the dining room first. And maybe the next day you want to take them along for a walk and point out landmarks. Ask the staff of the facility to limit the number of people coming in and out and introducing themselves. There was one study that stated that a new individual, especially in nursing homes, meets with about 19 people within the first 24 hours. Can you imagine that? How many are going in and out of their residence rooms? This is including staff, not just the people with the clipboards and the questions. Maybe we should pick just one person, like an activity director who's going to be the contact person for that first week if possible, and communicate either verbally or in writing. If your elder has been receiving home care, have the scheduled caregiver continue to visit that new community for the first week or two. This helps with transitions and can be very beneficial for the staff that need to learn about that new resident. And then if you can, families or an activity person or someone caring for them, join that older adult for meals at least for the first couple days, and then choose a quiet area in the dining room. If you look and sit and eat in your dining room, whether it be, again, in assisted living or a nursing home, it can be kind of loud and upsetting, and they could be agitating. And then limit that by keeping that older adult with possibly dementia or having some cognitive issues in a quiet area. You've got to keep happy. Show joy. Show that their loved one, even living with dementia, they are able to not necessarily understand their words, but how you make them feel. How you make them feel. And then prioritize, make a list, and make sure that we keep to their normal regime of activities. This is just a little plan of care related to a temporary plan of care related to transfer stress syndrome. By doing this, key points as we walk through this, your older adult is going to have some transfer stress and related to a move, at least for up to 6 months to a year. The older adult is going to exhibit signs of stability, or they're going to exhibit that deterioration in mood thought exhibited by anger, depression, and withdrawal. A lot of times when individuals have dementia or Alzheimer's, when they move in, the first thing we might do when they can't sleep at night is try to give them medication. Let's put medication aside and look at that underlying need related to that relocation stress. Brittany's going to talk about strategies to educate the care provider for this implementation.
Thank you, Colleen. So educational needs for your professional staff. Our number one goal when it comes to training is enhancing our professional staff skills while improving the quality of care for clients. We want to promote staff and client safety, comply with regulations, and attract and retain quality staff members. Why does having a comprehensive training plan matter for professional caregivers? Training provides employees with the skills they need to provide quality professional care. Caregivers who receive regular training are more likely to feel supported and engaged in their roles. They're also more likely to be more satisfied and comfortable with their position. Training plays a vital role in the home care industry, and it's not just meeting the requirements. It makes sure caregivers are well equipped to provide top quality care. It helps caregivers feel supported and engaged in their roles. This can actually help reduce caregiver burnout and turnover. Training can encourage career development and advancement opportunities for caregivers. Adding training and education can encourage a higher interest in learning, and interest in learning that can lead to a career advancement. For example, having a caregiver pursue a nursing job. Training can aid in stress relief and management. Caregivers who feel well prepared and supported in their roles can have lower levels of stress. And training can lead to improved satisfaction of clients as they're receiving consistent quality of care. The more knowledge, skills, and experience your caregivers have, the higher likelihood for their productivity and effectiveness in the care they provide. The first part of thinking about a training program and a training plan is to think about not only providing initial training to new hires, but also to provide ongoing training on at least an annual basis. It's always important to touch back on important topics, to provide re-education as needed, especially as we touch on today's topic of relocation stress. We want to make sure we provide the valuable trainings and supports to our staff so they feel comfortable and confident providing care, especially as we're working in a transitions of care environment. As you create your training plan, make sure you have clear goals. The first of those is to make sure we include all compliance requirements. Of course, looking at state and federal level, as well as CDC guidelines and any other guidelines you may be required to follow in your organization. On top of hitting all of the required content, you also have to consider what content you want to include that may not be required, but will really add to the goals of your training program. Adding in additional training can greatly help, especially when we think of a topic like relocation stress. We want our employees to really feel like they are able to offer assistance to these clients as they go through this transition of care. They need to have a plan. They need to have tools, and they need to have interventions that have a higher level of success. You also want to communicate your training plan to your team and staff, and make sure that you encourage communication and questions to be brought to your training lead. Regularly look at your training plan and adjust, add, remove items as needed to ensure that you are constantly hitting the goal on the training that you're looking to provide. Don't be afraid to ask for employee feedback, as this is how you can adjust and readjust your training curriculum to fully meet the needs of your staff. Ask what items are missing. Are there topics we're spending too much time upon? Is the information presented in a digestible format? Feedback is key to building a program that's going to be meaningful and successful. We want to make sure that we are proactive in our training planning. We do not want to be constantly reacting to situations. We want to try to anticipate the tools and interventions that the team will need. I encourage you to always take a proactive approach to training. It's much easier to provide training ahead of time versus responding to an issue and feeling as though you're quickly and very reactively adding new training due to a missing link in your previous training. Let's talk about ongoing surveillance. Many of us are already checking in for reassessments or periodic supervisory visits. Make sure that you are taking advantage of seeing your professional staff members in action. Are they following protocols? If not, use this as a teachable moment. Provide on-the-spot training. Coach your team by example. Show them proper techniques if needed. Keeping the lines of communication open and encouraging them to reach out with concerns. You want to be available and respond promptly to caregivers' training questions and concerns, especially keeping those lines of communication open when we're working with a client who is in a transition of some kind, such as a move, regardless if that move is planned or an emergency response. Now let's discuss training implementation. Always keep your compliance requirements at the top of mind. Reassess your training plan and programs continually to make sure that you are covering all pertinent policies and topics. Also, learn from mistakes and missteps. If you have a situation that did not go well, especially with today's example of stress relocation, use your past experience to improve your future program. Add new trainings that can improve your processes. Adjust the training as needed. Do not be afraid of tweaking your program time and time again. Your goal is successful supportive care. We are not always going to hit our goals perfectly on that first try. So adjusting and perfecting your process will really lead you in the right direction. How to be successful. In-person training can be great, but consider also maybe leaning into technology and virtual ways to provide training. If you are not ready for a fully virtual training or not able to provide a fully virtual training, consider a blended learning model. Hold some parts or topics in person while holding other components in a virtual element. Utilizing technology can save your company time and money. Utilizing technology can also keep organizations up to date with compliance regulations. It's quick and easy to provide updates and changes to your whole organization, especially if you need to get urgent information out to your team. It's quick, efficient, virtual, meaning it's at their fingertips, right? We all are, holding those smartphones, or they're within, a reach to grab them. So it's easy to get that information to their fingertips. It can also allow learners to work on their own timetable and convenience. Of course, staying within the due dates for training to be completed, but they no longer have to schedule coming into the office to complete training, or you no longer have to present multiple sessions on the same topics. This can be very helpful and desirable for both learners, which are our professional care staff, as well as our training professionals, which many times are our nurses. Virtual training can be readily available 24 hours a day, meaning it's convenient. To get started on virtual training, consider looking into learning management systems to meet this need. These can be purchased with top-of-the-line content, or you can home grow your own content. So, of course, depending upon what your training needs are, as well as your budget, there's really a way that you can utilize what you have available to you. Schedule yourself time for reflection. We stop and take a look at the training plan. For myself, that's every 6 months, at least, to make sure that we're covering all important topics, adding in anything that should be included in the future. Remember, policies change, requirements change, new research becomes available. We constantly need to keep a pulse on the training and make sure that it's meeting our needs. So be flexible. Training programs are ever evolving. And a best practice that I think always should be mentioned is to really maintain caregiver success is supplying them with an open door policy. Your team cannot be successful without the support that they need. They need open communication. They need to be able to bring up client concerns, and they need to feel as though they are supported and heard in an efficient manner. An example of a training plan in action. In our example today, I want to share about an office who had an opportunity to provide caregiving support in a building with clients who were mostly bedbound. Many of these clients were coming from living in their own homes and now transitioning to a care setting after either having an accident, having a change in the level of family support, or a recent diagnosis where living semi-independently was no longer an option. This office had to not only provide for the basic required needs of their state, but they also needed to ensure that every caregiver had the training necessary to meet the needs of many of these clients no longer being mobile. They also included a huge part of their training to assist those clients coming from a transition of care environment. One client in particular came to this new building after her home had become inhabitable after a large tree had fallen on her home during a storm. This woman, who was semi-independent, she had periodic caregiving services, but still lived on her own overall. She came in very depressed over the situation of her home no longer being a viable option for her to live in. During our initial assessment, our nurse noted that she was very depressed, withdrawn, and seemed to be very angry and confused in general about her new living situation. Our nurse right away wanted to independently brief each caregiver that would work with this new client. She wanted to provide strategies to encourage the client's independence. She wanted to provide interventions to help the caregivers with the client's day-to-day care, but also her mental outlook. She also wanted to limit the amount of caregivers working with this client to provide this client with a more stable environment that really held daily consistency for her. The nursing staff paid close attention to this new client, making sure our plans and strategies met her needs. They adjusted the plan as needed, and they looked for caregiver feedback and client buy-in. Making sure your staff is mindful of the effects of relocation and the stress that can be caused to our clients is important so that we can be successful in noting when a client is potentially at risk for experiencing some negative effects due to their relocation and transition of care. It's important to provide training on a broad scale of what you want all caregivers to have knowledge on, but also provide more specific training to particular caregivers that really go hand in hand with their client's condition, situation, and even their mental outlook. Give these caregivers guidelines that can change the day from being difficult to working easier. We always say we want our clients to have better days, and individualized training by client condition is absolutely one way that we strive to do that. Our team has also created, which can be best described as training in a minute. And what I mean by that is we took multiple topics, including relocation stress, and we created educational videos that are 5 minutes or less. These give our caregivers a quick reminder of what a particular condition looks like, tips and strategies to be more successful with that client. These have been huge. Caregivers do not always have 30 minutes or an hour to dedicate to a last-minute training session, so these training in a minute videos really can be helpful in just giving them that extra push of education, confidence, and tips for what their day with this client will look like. Listeners, visit ComForConnections.com to download complimentary resources, view show notes, and access our episodes. You can also subscribe to our podcast on your favorite app. Thank you for listening and helping older adults live their best life possible.